I'm proud today to speak about our study, that is the NOCAT trial, an academic trial of non-operative management after total neoadjuvant treatment in locally advanced rectal cancer, proficient mismatch repair. The study is a single-arm phase 2 trial with the aim to demonstrate that avoiding surgery did not jeopardize distant relapse-free survival in patients following the clinical complete response after total neoadjuvant treatment. The first results show that 1 out of 4 patients reach a clinical complete response, and the distant relapse-free survival of this group of patients is very high, is 97% at 30 months, and this is well above the predefined boundary of clinical meaningful survival that we posed in the trial design. Yeah, about safety, we can say that we had a toxicity in line with previously reported literature. The total neoadjuvant treatment we used is the capox for 4 cycles, followed by 5 weeks of long-term chemoradiotherapy, and the expected toxicity was in line with the literature. We had only 1 toxic death, and all reported deaths were mainly due to tumor progression in patients not responding to treatment. An important question of the trial was the translational questions, and we found that some biomarkers like circulating tumor DNA can predict clinical complete response and worse distant relapse-free survival, along with transcriptomic analysis that was carried out on the tissue biopsy before total neoadjuvant treatment. The predictive power of liquid biopsy was assessed on the blood sample taken after the end of total neoadjuvant treatment. The next steps will be surely do a lot more efforts to integrate these biomarkers into a clinical algorithm in order to better select patient candidates to organ preserver strategy. I hope that we will be able to not only identify better people benefiting from this treatment, but also to improve the treatment in order to improve the organ preservation rate in our patients. Yes, this was a very difficult study to conduct because we started in 2018 and we go through the COVID pandemic. So it was a huge effort from 4 academic institutions, and I think that these difficulties makes our results more important.